Hi, I'm Dr. Raj Kakar. I'd like to introduce myself. I am a physician specializing in sleep health. I've been a medical doctor practicing sleep health for over 20 years. I started out as an undergraduate student at LSU, graduated from there and went to Tulane University in New Orleans for my medical degree. And finally, I ended up at Stanford University for a sleep medicine fellowship, which I completed there about 20 years ago, and in 2004. Since then, I've founded and established my own clinics here in the North Texas area. I am the president and founder of the Dallas Center for Sleep Disorders, also known as Dallas Sleep. I am also the president and founder of snoringandfatigue.com, an online sleep health service platform. And finally, I'm also the founder of CleanPap. CleanPap is a revolutionary new CPAP cleaner for helping to simplify cleaning CPAP parts. Today I would like to discuss snoring. Many times people ask me, what is snoring? What causes it? And why do I have it? Well, it's a great question. And so what I'd like to explain is really that snoring is a sound, of course, that develops somewhere in the upper airway between the nose and the back of the throat. It really primarily occurs, in my professional experience, in the back of the throat. Most snoring, I would say 95% or more, occurs in the back of the throat. That's where snoring happens, and that's because of the size and shape of the airway and the narrow airway, which contributes to this problem. Nasal snoring is actually very uncommon, quite rare. Why do people develop snoring? Well, it's really because of the size and shape of the jaw structure, the anatomy, which affects the size of the airway in the back of the throat. Many times there's a huge misconception among people and even among the medical community when they think that snoring is really a result of being overweight or obese. In fact, that's absolutely not true. Being overweight or obese can increase the severity of snoring or even sleep apnea. Being overweight or obese is not actually a cause and not the underlying cause for snoring or sleep apnea. So that's very important, and that's been a huge misconception over the years. So really, snoring and sleep apnea are caused by the size and shape of the airway being on the narrow side, which predisposes somebody to developing snoring and breathing problems during sleep. So it's essentially an anatomical development. And this is hereditary. So you'll see that snoring and sleep apnea actually tend to run in families. And it's actually very common. Runs in a lot of families all around the world. So now I'm going to actually show you a little bit about what I'm talking about. Okay, so here I'd like to show you this image of a male in his 50s who we did upper airway imaging. We call this upper airway imaging. It's done with a mini CAT scan done in the office. It's a digital imaging, so there's really hardly any radiation with this kind of CAT scan imaging. It's commonly done in dental offices, actually, for looking at teeth and the dental structure. Here we can see that, to give you some orientation, we're looking at the head and neck from a side view. Here on the right, this is the chin. These are the lips here, and then this is the nose here on the right, upper right corner. If you look down here, this is the lower jaw. This is the upper jaw, and these are the teeth here in the front. This is the tongue here in the middle, the large tongue, which normally takes a good amount of space in the mouth. And this is the back of the throat here. So you can see the back of the throat. This is the airway. The dark black area is the airway, actually. So coming from up here to the nose through the back of the throat. So the next thing I'd like to point out is this is the upper jaw here. Coming from that upper jaw back here is what we call the soft palate and uvula. It's a thin strip, which is what hangs in the back of the throat, and you see the uvula hanging at the end of it when we look in somebody's mouth. Here, we're looking at it from a side view, so it's kind of blends in with the tongue. It's just laying on the back of the tongue, which happens in many people. And so they kind of blend together, but this is the soft palate and uvula here, and it sits right behind the tongue. And it's where they overlap, then in some people, we see some narrowing here in the back of the throat. There can also be some narrowing further down, just behind the base of the tongue. But this is really what the airway, the area that typically is involved in snoring and even in sleep apnea. What happens is if this airway is narrow to begin with, as it is in this case, then that can contribute to snoring and even sleep apnea. In our experience in men, we found that if this airway size is less than 10 millimeters when somebody's in awake state, like in this case, if it's less than 10 millimeters, that increases that person's risk for snoring and sleep apnea. Similarly, if it's less than 8 millimeters, about 8 millimeters or less in women, then that increases a woman's risk for snoring and sleep apnea. The more narrow it is, the higher the risk based on our experience. And what ends up happening is when somebody's sleeping at night and they're lying on their back or their side, well, everything tends to relax and collapse even more. So let me show you. So now I've kind of flipped the image so you can see everything tends to relax and fall back when somebody's lying down. So in a relaxed state, this becomes much more narrow. Similarly, in a relaxed state, the lower jaw tends to relax, which allows the tongue to drop back further. So again, this also becomes more narrow down here. So all of this becomes more narrow when we're sleeping. And that's what, again, can contribute to the snoring because of the difficulty of the air to get through here. That's what creates that vibration sound of snoring. And if it's so severe that the airway closes completely or almost completely where there's limited amount of space there, that can cause sleep apnea. Let me show you one more image. Here's another image of a male in his late 30s. And so here you can see the airway is even more narrow. So again, giving you some orientation. Side view of the head and neck. Chin is down here on the right. Lips are here. Nose is right up there. This is the lower jaw, this upper jaw, front teeth. And we're zoomed in a little bit more so the nose is a little higher there. This is the tongue, which normally takes up a good amount of space in the mouth. And this is the back of the throat over here. So coming from the upper jaw here you can clearly see the uvula, soft palate and uvula a little bit more clearly, sitting on the back of the tongue behind there. And then again, this is the airway behind where the tongue and soft palate uvula overlap. And this is the airway size behind the tongue base itself. And in both cases, you can see the narrowing is as little as 3 millimeters, 3.5 millimeters to 4 millimeters of space. Not a lot of space back there to begin with. So again, this individual is unsurprising, has a history of snoring and unrefreshing sleep. So when they sleep at night, everything relaxes even more, so this becomes more narrow. Same here, the lower jaw can relax during deep sleep, which can allow the tongue to drop back further, causing further narrowing. And that's what contributes to the snoring and sleep apnea. And I can tell you this individual has a normal body mass index, normal weight, is not overweight or obese. So again, it's a structural anatomic problem, which is hereditary factors which predispose an individual to developing snoring problems. So that's how snoring occurs, and that's what causes snoring. So I hope that was helpful for you, and we plan to discuss more about what is sleep apnea in the next video. So stay tuned for that, and then we'll get into what is sleep apnea, and we'll continue our series of discussions. Thank you for watching.